You could call it a mobile hospital for COVID patients. It's already on the ground here in the Valley. New at 10, Christian Colon takes a closer look at this clinic on wheels.
From hospital to hospital, this large ambulance, also known as AMBUS, is making its way around the Valley.
One hospital could be flooded and not be able to accept any more patients. So the AMBUS, what it's doing is moving those patients that are at big hospitals to an alternative site where we can increase the footprint of that hospital.
It's part of the State Emergency Medical Task Force. Weslaco Emergency Manager and Fire Chief Antonio Lopez houses it in his city. This AMBUS, the only one Lopez says south of San Antonio, is brought out in critical situations. For the past few days, it's been helping local hospitals with their fight to find space.
So the average is about 45 to 50 continuous 911 calls in a 24-hour shift. So that's a lot of calls. And sometimes we have a hard time clearing those ambulances from the hospital.
This bus does the work of 10 ambulances combined. About 20 COVID patients could be let in. The patients are given oxygen and other treatment until they reach another unit or another hospital. With every call, Lopez says they expect the worst.
Slow the call down, wear your proper PPE, and limit the exposure.
The hunt for space even brought South Texas Health System to expand into a tent. This tent facility, also provided by the Weslaco Fire Department, can fit about 20 patients.
We are looking at resources that we have along here in the Valley and throughout the state to see if we can locate one of these other tents and request it for another facility.
Lopez urges people to practice health guidelines to avoid infection. He also reminds people that only call an ambulance in an emergency.
But if we keep flooding the ERs with just reassurance calls, I said we're going to attack that system real quick.
In Edinburg, Christian Colon, Channel 5 News at 10.